Welcome. In this video, we'll walk through key coding steps for radiology X-ray services covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. When coding for TMJ imaging, two CPT codes are typically used: 703 to 8, radiologic examination, temporomandibular joint, open and closed mouth, unilateral. This code is used when imaging is performed on one side only, either the right or left temporomandibular joint. It includes two views, one with the mouth open and one with the mouth closed, to evaluate joint function and alignment on the affected side. You would report 70328 when the provider specifically orders a unilateral TMJ exam, often due to localized symptoms such as jaw pain, clicking, or dysfunction that is limited to just one side. 70330, radiologic examination, temporomandibular joint, open and closed mouth, bilateral coingens. This is used when both TMJs are imaged, again with open and closed mouth projections. It's important to verify the clinical documentation and radiology order to determine whether 70328 or 70330 is appropriate. There are two common radiographic views used to evaluate the TMJs: temporomandibular joint AP axiolateral view, temporomandibular joint axiolateral oblique view. These views allow radiologists to assess joint spacing, bone integrity, and motion abnormalities of the jaw joint. Let's review a sample radiology report for TMJ imaging with CPT 70330. Order exam: TMJ bilateral open and closed mouth views, header open and closed mouth views of the temporomandibular joints. History: early onset rheumatoid arthritis. Comparison: none available. Findings: osseous structures appear demineralized. The temporomandibular joints are unremarkable to the extent visualized. Straightened upper cervical lordosis. Impression: subjective demineralization. Unremarkable temporomandibular joints. Key terms like bilateral, open and closed all support the use of CPT 70330. Always ensure the imaging documentation clearly reflects the views and sides examined. Let's review the appropriate ICD-10 CM code for this case. Based on the radiology report, which notes osseous demineralization, the correct diagnosis code is M8588. Other specified disorders of bone density and structure, other specified site. This code is part of the ICD-10, covering musculoskeletal conditions. The M85 category includes disorders related to abnormal bone quality that don't meet criteria for osteoporosis or are not part of a broader, confirmed condition like rheumatoid arthritis. In this scenario, RA was only being ruled out, and the only objective finding was demineralization. Because the temporomandibular joint doesn't have its own specific code under this section, we use other specified site, which is why the code ends in .88. To summarize, M85.88 is used when a radiologist documents demineralization in a location that isn't captured by a site-specific bone code, and there's no confirmed systemic diagnosis. Always remember, we code based on what's documented, not what's being ruled out. Thanks for watching. Be sure to check the links in the description for helpful resources, and subscribe for more radiology coding content.